Good morning, everybody. My name's Patrick Egan, as Bridget said. I'm going to build on what Alistair has said and go in a slightly different direction, in that what I do with customers is help them grow, whether it's finding private customers, direct payment customers, winning contracts with councils, anything at all to grow, essentially. So moving straight on, first bits I want to look at is just tell you the three areas I'm going to cover, which are about using your strengths and experiences as a company and trying to be innovative and imaginative there about where you can find more business opportunities and how you can pursue them. Also looking at promoting your company, the ways to do that, the language to use, how to sell all the time, but without needing to be a salesperson. You didn't come into this industry to be salespeople probably, and it doesn't need it, but it does require obviously a lot of selling and promotion of your organisation. And the third aspect I want to cover is about winning contracts. And I'll look at it from a slightly different view from Alistair, who looks at the process involved and all the rules and regulations. I would like to talk about getting in there and winning it and taking that contract home, because that is what I help customers do. So, moving on firstly to service resources. One of the things perhaps to look at is the services that you're prepared to offer. You may just do services for the elderly, you may do them for younger adults, you may do them for children. But to ensure that you've got the greatest opportunity to grow, you need to look at having the widest expanse of services possible. If you take children, for instance, young people, if you don't plan to offer that service, you're ruling out 18 years' worth of providing personal care and support to young people with disabilities, whether they're physical or learning disabilities. They're not going to suddenly turn around after 18 years and come and say, hello, I'd like to join your adult services, can I please have a care worker from you? They're going to stick with the people who provided them with services for the last 18 years. Have a think about PA support. You can see it as a direct competition to you. Great, embrace it. Offer PA services. If customers wish to use PA services, offer them backup for that. Show them how you can do the payroll for them, how you can train staff for them, how you can provide holiday cover, sickness cover at the drop of a hat. Don't see it as a threat. See it as an opportunity to have different strings to your particular service bow and an opportunity to grow your business. With the supporting people services as an example, you may or may not have housing support services as part of your business. Now, just a very few years ago, housing support, helping people get benefits, helping them live their lives, fell entirely outside of the regulation process. They're now within the CQC format, and guess what? They're targeting your business. They're not just saying we'll carry on doing what we were doing. They're going to target your business to provide home care, to provide home support. They're doing it already. You have got the opportunity also to provide the services that they do. There's nothing to stop you providing housing support to individuals with any types of needs. It's about looking at your business and seeing what skills you have and how you can use them to your best effect in terms of growth. A slide aside in terms of, let's say, a new mum service. Perhaps not a traditional home care offering, but lots of people have lots of children. Let's say when a new mum goes home, the technical expression might be that she's completely knackered. She might be looking for some help. Her partner, superb of course, probably not, probably useless. There are people out there who will pay for your services if you offer something, imaginative. There are people there who will buy it. It's about looking at who you could supply, how you could support them, and then putting that in place. And of course, go talk to your customers. Ask them what they would find valuable. Ask them what new things they would like to see you do. There's opportunities all over, whether it's private customers, talking to the clinical commissioning groups, going to the NHS, going to local authorities. Of course, you can go to all of those types of outlets, but primarily you need to think much, much more about attracting individuals. There's not so much block contracting, again, as Alistair has said. You're looking for people who are private payments, direct payments, who've got budgets, as well as the traditional route through the local authorities and the NHS. So have a think maybe about the service expansion side. Perhaps 15, 20 years ago, if you were in home care, a lot of your business might have been boring things like housekeeping, cleaning, helping somebody do the shopping. A lot of that has gone by the board in procured home care as the needs barrier has been raised and raised and raised. That doesn't mean you have to go with that to only offer high-level personal care. You can offer lower-level services as well. Get somebody in terms of preventative care, offer preventative services, help somebody with their housework, help them with their shopping and their ironing. They will be a customer for a long, long time because you grabbed them early. Don't just concentrate on what home care is doing at the moment. Have a think too about looking at specialist support, health support. Are you able to get a nurse into your organisation that would then let you offer support that had healthcare elements? And I'm not talking about employing nurses to go out and deliver service. I'm talking about having a nurse within your organisation who perhaps can help skill up your care workers so that they can offer services above and beyond what is usually regarded as top-end personal care. And have a think too about more imaginative and new aspects that are happening now. You may have heard about exercise on prescription, books on prescription. The doctor, you can go to your doctor now and he can say, Patrick, you're a very depressed person. I recommend you go to the local library and I want you to read books 3 hours a week. It will do you the world of good. I can get that prescription now. Which of you wants to offer the support for a care worker to come along and help me do that? Someone might. If it's not you, somebody else will do it. I'm suggesting you think about all those different opportunities and essentially just throw away the rule book of what home care has always done. Think about what you could do and try and put that together. But on the time front there, obviously you don't want to just go off and do that in an unplanned way. You need to carefully think about where your interests are as a company, what your skills are, what your resources are, maybe big, small, in between. And depending on that, you need to think carefully about which routes you follow. The grid up there at the moment is very old structure. Service penetration, doing more of what you currently do for the same customers you currently do it for. It's a tried and trusted way of working. Unfortunately, it's low opportunity in terms of growth. It's not very risky, but it's not very exciting, and everybody else is going to be after that business. If you look at service development, about trying to find new services for existing customers, and try and just think about all the different opportunities you can in that section. With market development, try and think about established services, but to new markets. That would fit, let's say, the new mums. And with the final section in there is one to avoid, as it says it's blank for a reason, which is what some people recommend, diversify. Please don't. Most companies that diversify, unless they're huge, unless they've got massive resources, it's a disaster. They go into markets they don't know, they provide services they're not capable of providing, they waste their time, and they make no money. And it's usually a very bad route. That is different, however, to trying to add elements of service, to trying to tweak service elements, to go for slightly different customers. You've got the skills to do that. That's the route to follow, not diversification. Where's that gone? Moving on to your sales. Sales, you've got to have messages out there 365 days a year. People just don't suddenly think, yes, must phone a home care company today. They have a need at one particular time. It might be their mum's just been taken into hospital. Never thought about it before. She's had a stroke and wowee, we need some help. That is when they're going to think about it. It's not planned for most people. It's immediate. It's now. But your message has got to be out there. Otherwise, they're not going to see you. They're just going to see the usual names. They'll see Care UK, Care Watch, whoever. They won't have heard of you unless you're promoting all the time in as many ways as you can possibly think of. NHS Choices has obviously recently started. You may even have put a profile on there. But you do need to check that even if you have done that, that you've also registered and put your profiles up with the feeder sites, the 6 feeder sites that link to NHS Choices. And they're your opportunity. They are Good Care Guide, Really Care, Search Care, the Social Care Institute for Excellence, Your Care Home and Compare Care Home. And don't even get put off by the ones that say Care Home. They have got sections that deal with home care. So you need to be registered with all 6. You need to talk to your customers, people who think your service is good. Ask them to rate you. People look at ratings these days. They look at it for holidays. They look at it at where they want to go for the local restaurant. People are also going to look at ratings for home care. It may not be happening much now, but it is going to happen. That is the way our customers are moving. They're becoming much more sophisticated and much more picky, and they're willing to look around. They're not just waiting to come just to you. With your traditional methods of promotion, your website, your brochures, your leaflets, yes, they're all still important. Even the favourite old leaflet. That's from last week through my door from Care UK. If it's working for them, it can work for you, but the message has to be good. It can't just be, here is ABC Home Care, we're wonderful. Well, we'll come on to the message in a second. The website you've got, is it selling you? Is it coming high up in search engines? Does it say what it can do for customers? If you want some help with your website, I would suggest you go to an organisation called HubSpot. They're experts. They have got huge amounts of information freely available for you on any aspect of your website. Look at support organisations. For different needs, disabilities, health needs, whatever it may be, there are carer groups out there. There are support groups out there. They are desperate to hear from you. Their job is to give information to people who join their groups, who look to them for support. But unless you make yourself known to them, they haven't got the opportunity to share the good news about your service. Again, nobody will hear from you. If you take this one, this is a national organisation. It's a support group for learning and physical disabilities. This is 18 pages worth of support organisations that they are promoting to people who look to them for advice. And this is just one of thousands. 18 pages. Anybody like to guess how many care support organisations are in there? Okay, I'll give you the answer. One company has managed to have the oomph to put themselves forward to this group and say, please tell everybody about us. There are opportunities like this going begging that you can take advantage of. They're there today, they'll be there tomorrow, but obviously the quicker you are, the better position you'll be in. But those opportunities are there. PR activities. Go to your local school fete. I've got clients who run cake stalls. They're there, they've got their polo shirts on, they've got their badge. They're making themselves known in their communities. They are getting involved. They're going to the WI and giving a quick talk about how to help somebody with dementia, how to help somebody who's a bit unsteady on their feet. As a result of that, they're growing their connection with the communities. They're growing their ability to attract new customers to their company. Content and language is very important in all your sales work. And when it comes to language, please remember you're not selling to the CQC. You're also not selling to a council. Dignity, outcomes, respect, they're for the CQC. The average customer would probably like to know that your staff are caring, kind, turn up on time. Much more everyday language. Let's not get the two mixed up. One is for your professional approach and your professional discussions with social workers and CCGs and the NHS and councils and the CQC. The other is how you interact with customers. Real people don't talk like that. They talk about what suits them every day, what they want, what they need, what would help them. So please have a think about that. Again, in your marketing material, talk about your customers, not yourself. They don't want to hear how great you are. You might want to say that, but it's really not a good sales message. What they would like to hear and what will get you the most results in terms of customers coming to you is to tell them how you could help them. Give them examples. Show perhaps how your care support services can help somebody stay at home for X £100 a week rather than having to move into a care home at £1,000 a week. Explain things. Show how your service can really matter to people, but in their terms. Again, with sales, keep it short. Go for things that are easily understood, because people are not going to spend ages reading your website. They're not going to spend ages reading your brochures or your leaflets. The points need to jump off the page at people. They need to be able to see immediately what you've got, what's in it for them. And for a guide on that, I would suggest you go to the Royal Mail website. May not be great at delivering letters. With direct mail and how to get your arguments across in terms of marketing material, they are expert. And you will not find better advice, no matter how much you might pay for it. They are the best. With your material, ask people to do something. Don't just have leaflets that finish and your telephone number is down the bottom. Put it on there. Call us today. Make an appointment. Ask for a no obligation discussion. Ask people to do something and they probably will. They're much more likely to get involved if you make that request. And don't forget everything else about your service, your prices, your uniforms, your paperwork. Does your paperwork you put in people's homes contain sales messages about what else you could do for them? Probably not. Your care plan probably just says, here's what we can do, and here's what we'll do in this outcome, and here's what we can do in bathing. They'll forget what else you can do for them. They may go somewhere else if their needs develop. Put sales messages in everything. Tell people what you can do for them at every stage of your contact. Moving swiftly on to winning contracts. Alistair gave us a lot on this area. My bit is very short, so you'll be glad to hear. With finding contracts as the start point, notification services that you might sign up to and pay for are really good. But please, please, do not rely on them. They're run by computers. They're run on numbers and things being in the right box at the right time. Again, life isn't like that. The computer will not find interesting opportunities for you. The computer doesn't look and think, yes, that's just like this service that this company operates, therefore I'll notify them of the opportunity. Regardless of what notification services you're signed up to, you really, really need to do some personal searching on the types of things Alistair mentioned, on TED, on local authority websites, on portals. If you'd like a listing of those, you can download a list free of charge off my website. It's a starter point. but please don't leave it to computers to decide about how successful your business is going to be. On preparation for tendering, think until it hurts is easy to say but difficult to do. Again, Alistair made the point, but what purchasers are looking for when they're buying services is not just what you know. You have to almost forget about what you know. Go back to basics. Think about what the people running the contract want to hear, what they need to know about your services. Go back to basics. Don't go with what you know. And writing the proposal, the rule of three, is to spend about a third of your time on research, a third of your time planning your answer and the response, and the other third writing it. As an example, if somebody wants a 500-word answer on tell us about your approach to personalisation, you should be putting aside about 4.5 hours if you want to produce a tender-winning answer. If you're not prepared to do that, pack up, go home, don't do tenders, just do other things. That is the level of input it will require from you. On good business writing, moving on to that, you need to spend, as I said, as much time in planning as in writing. To help you with that, you should use a response matrix. It's the only bit of jargon in the presentation today. It's no more complicated than a list of things you should think about when you're doing your responses. As I mentioned, don't just go on what you know. What the response matrix does is it makes you address each particular aspect of a question. So you'll look in the contract specification for what that says about personalisation and make sure that's covered in your answer. You'll look in the contract conditions to see if that's got anything. You'll look at good practice, maybe from the UKHCA, maybe from the Social Care Institute, maybe from clinical commissioning groups. They need to see that you are up to date. They'll want examples, case studies, evidence of what you can do. All of those elements need to get fitted into your answer. And you might only have 500 words. They'll also want to see added value and probably how you'll address the CQC outcome areas. Now, all of that fitting into just a short answer of maybe a couple of pages sounds like a lot of time and trouble, but that's why I'm saying you need to spend the time on these aspects. In terms of the actual writing, it must be personalised to each individual authority or CCG. You must give details. So if you're talking about how you would help somebody integrate with the local community, don't say, we'll help them join in. Talk about the local yoga centre at the Nora Green leisure place and make it specific to where you are bidding. That is what they want to see, real knowledge and your real commitment to going beyond the basics. Keep things concise so that you're not waffling, and on that subject I'll finish.
Thank you. Thank you very much. Okay, we do have just a few minutes for questions, and Alistair is still with us, so questions to either or both of them, because obviously there were some common aspects in it. We have a question down front here. I'll bring you the mic.
I'm David Hogarth, and I'm from the Westminster Health Watch. Certainly in my local borough, the procurement process, this is for you too really, Alistair, it was not just the professionals, but they were also bringing in users, and there was a user survey. And I wonder how common that is, and whether you have anything, either of you, to say about preparing for that. Because I know that some of the providers actually didn't do well at all on the users. They talked down to them and that kind of thing.
Thank you. Patrick, do you want to go first? And then
Perhaps if I answer that one, as I'm involved in a lot of tendering situations and presentations, the involvement of service users is probably in about a quarter of tendering and contracting situations. As you said, it's very important. I think it probably should be more, personally, but the reality is that service users are probably only present in about a quarter of the contracting situations. Yes, companies often do talk down to customers, to service users, because they talk in the wrong language, or they talk as though they think service users don't know about important aspects of social care, whether it's the legislation or their rights. And it's very important that you know, let's put it at its most basic, you treat people and you talk to them as you would want to be talked to yourself. You don't want to be talked to like an idiot. They don't expect to be talked to in that way either. They have got real needs, they've got real experience, and you should recognise that when talking to them.
Just as I hand over to Alistair, can I just say, because this is a subject very close to my heart, I think it's absolutely one of the measures of the quality of the service that the home care provider gives, which is how much they have involved the users of their services and their families in the process of defining the service and particularly of monitoring the service. And I think it really does help in terms of making bids and so on, if you can show the evidence that you do involve your clients, the people who use your services, absolutely at the core of what you do. And now I'm going to hand over to Alistair.
Yes, I've come across that a few times actually, service users being used in tender processes, and obviously that's a really good move. Yes, it does tend to trip people up because there's this sort of, how do we address the service user? Have they got issues that they're trying to address in being part of this process? I think really you have to be true to yourselves as businesses. You know, why did you go into this business in the first place? You know, was it to make profit, or was it to serve people in the community? And I think as long as you can focus on a personalised, your personalised outcomes and what you've actually delivered for people, and keep that in mind, I think you should be okay. But don't make assumptions.
Thank you. We have time for one more question, if we have another one. Yes, there's one in the middle here. Let me come down.
Sorry, good morning. My name is Adilson from Community Action Care Service. I'm a home provider for children and young people that are homeless and obviously need support. My issue is I've just recently bumped into a situation where the housing benefits actually provide housing support for homeless young children, right? I mean, my only concern is, will they, have the correct financial backings to actually provide the support for the young people that's with us? Because the housing seems to be giving us a bit of a push and shove situation.
It's the aspect of providing things such as housing support and benefit advice. It isn't linked to young people as such. It's linked to any age of adult. So it's not linked to children.
Young adults.
Yes, young adults. And the opportunity, I suppose, is not so much about every company doing that. It's about looking at whether it suits your organisation. If you're willing to acquire the skills to support people with their housing needs, with maintaining tenancies, with having a reduced, let's say, a less chaotic lifestyle in a lot of situations where there may be mental health needs involved, and whether you're also willing to look at helping them apply for jobs, help them get into full-time education or part-time. There's a whole range of services that need to be provided in terms of that housing support.
You want to come back?
Like I said, we covered all of that. We even had a pathway plan for young and vulnerable children in those conditions. Like my care home is practically the only care home that's actually got apprenticeship contracts and education opportunity. We're affiliated with Vocational College, and yesterday through here actually got London University that wants to do a partnership with us.
That's great.
It's great, but the unfortunate news is I'm not getting enough support from councils, and obviously the preparation for the tendering is, I'm getting there, but there's a lot of stuff that they keep asking. Practically, the tender to me feels like it's a restriction. It's restricting a lot of up-and-coming business providers as well that are on the right path. I've done all my background work, all the homework, all the research, everything's in place. I spent more time on the pathway development for the young children, you know, and to come across a tendering contract that they ask us, you know, questions that are way off the league, way off the topic sometimes, and it just slightly upsets me and makes things really, really hectic and really hard, which things are supposed to be simple in the care industry.
Yes, okay. I can appreciate your level of frustration there, but I would say one of the things is not just to think that the only way to get business is contracts and tendering, is to look for other routes, but also to recognise that, yes, in contracts and tenderings, the public sector do put hurdles in the way, but they're not putting them there on the whole. Sometimes they do. On the whole, they're not putting them there to be difficult. They're putting them there because they're things they really want to address. So if they think it is important, then you really have to think about how your service can address those issues that they want addressed, even if they don't sound important to you. But I do understand how much time and trouble that puts you to. I'm not here promoting the local authorities, by the way. I'm on the provider side. Get through it all, win the business. That's where I'm from. But I do understand how difficult it is. It is not easy. It's never going to become easy. But there should be lots more opportunities with all the splintering of, let's say in health, into clinical commissioning groups, the local NHS community work. The opportunities are going to come thick and fast, but from a lot wider range of people. And hopefully some of them might make it a bit simpler, but I wouldn't hold your breath.
Thank you for that. I would just add to that, there is no substitute for actually sitting down and talking with people and finding the common ground and working out from there. And if we are going to crack any of the challenges we're facing at the moment, it is absolutely by talking with the people who need the services, with the commissioners, and as you've heard from Patrick, a wide range of commissioners now. Because actually, deep down, we're all here for the same purpose, I hope, which is about the welfare of the people that we're providing services to.